Good afternoon and a very warm welcome to another Cutis webinar, or as we call it now, CutisTV. I hope you are safe and healthy and well and all excited about the second phase of post-circuit breaker. I would like to thank our patients for being so encouraging during this circuit breaker period, and also so understanding for the many changes of appointments that we had in the last couple of months. The circuit breaker was definitely a difficult period, but it also has allowed us to focus on an element that we have often neglected, and that is education. So we have started with a lot of webinars in May, and I just want to show you some of the webinars that we have done over the last couple of months. So here it is. We have done a webinar on aging, one on therapy, collagen, one on how to have the perfect Zoom face with a makeup artist, looking your best even when you can't do treatments. That was back in early June when we thought that the phase 2 is still a long way away. And also we had one about CrossFit, because we thought that looking good has also other elements other than just the aesthetic side. It has an element of nutrition, an element of exercise. So we had a very interesting discussion with Julia from Enduro CrossFit earlier this week. And today we're going to talk about really the core of what we do here at Cutis, which is restoring facial balance using dermal fillers. That is really an area where clinics can differentiate themselves from other clinics, where doctors can differentiate themselves from other doctors. I mean, it is true that machine-based treatments like therapy are also operator dependent, but really when it comes to fillers, this is where the doctor is critical. And that's why when we communicate the value of doing fillers in our clinic, you are actually getting or paying for the painter, you're not paying for the paint. So that's a real important view that we have about the dermal fillers, because it can make you look great or it can make you look not so great, and there are also definitely risk involved with doing dermal fillers. We have also done a couple of smaller videos that have been the result of a patient asking us specific questions, like for example, what is baby Botox, or what is Profilo, or what is this Botox for pain, and so we have done a series of these smaller videos, 2-3 minutes, where Dr. Sylvia explains the specific or answers the specific question. All these materials are going to be on our Cutis Medical Laser Clinic's YouTube channel. So go to our YouTube channel, check it out, subscribe, and see what we have there for you. I wanted to show this awards because obviously it is very important for us the focus on patient satisfaction. But I also want to highlight this that the awards from Expert Living, which is very dear to us, because our clinic has a large proportion of expert patients. I think last count it was about 60% expert. So we work very closely with Expert Living, and Expert Living has also helped us to put this webinar together. So I'd like to give out a shout to Expert Living. If you want to check out their website, it's expertliving.sg. Everything you want to know about expert life in Singapore and Hong Kong, you can find on their website. They're awesome. So just some housekeeping rules. We're not going to be able to unfortunately show before and after photos, although that's really what we can show here in the clinic. Photos of patients who have given the consent to show their photos, but in publications like this, or in view of the guidelines from the Ministry of Health, unfortunately we cannot show any before and after photos. Questions. Please ask questions on Zoom. We're also live on Facebook. I'm not quite sure when I'm going to be able to see the questions on Facebook, but I will try to also get the questions from Facebook and answer them here directly. Dermal filler poll. That was more as a reminder for myself. I'd like to do a short poll now in relation to dermal fillers. Let me just see how I can get this started. Launch polling. Okay, so question to all of you who are watching here on Zoom. have you had dermal fillers before? And the second question is, in your view, what is the biggest barrier for people trying dermal fillers? So I'll just leave it out there for another couple of seconds for you to answer. So have you had dermal fillers before? This is just to give an idea of who is here on Zoom. And also, what is the biggest barrier? What do you think the biggest barrier is for people trying dermal fillers? Is it because they fear of looking unnatural? Is it the pain? Is it the price? Or is it because they don't seem to find the right doctor? So couple more seconds and we'll close the poll. Okay, I'm gonna close it now. Well done. Okay, so I'm gonna share the results now. So a large, not a large, but a majority has had dermal fillers before. So that's about 55%. And the two biggest issues with fillers is looking unnatural and the price. But looking unnatural is one of the biggest issues. And I think that's a very good point, because I have a challenge for Dr. Sylvia where we talk about this looking unnatural. Okay, so this is a photo that I thought it would be important for you to see. This is what you can expect when you come to the clinic now. This is how our ladies are clothed in full PPE. Obviously, we take the advice and the guidance from the Ministry of Health very seriously, and so we followed the guidelines, best practice of keeping everyone safe, our staff and also, of course, our patients. Now, let me introduce our expert for today, Dr. Sylvia. Many of you know her already. She is the medical and scientific director of Cutis Medical Laser Clinics. She has a vast experience, both clinical and academically, in the field of medicine, mostly from the East Coast of the US. She is double board certified, which is really quite unique, also for a physician here in Singapore, which means that she actually can practice in the US as well. She's double board certified in pediatric nephrology and pediatrics. About 12 years ago, she has shifted her focus to aesthetics and has applied the same rigor and scientific approach of her previous medical life into the field of aesthetics, with a few diplomas and a master's, as well as writing papers in that particular field. So I would like now to welcome Dr. Sylvia.
Hi, Gunther.
Hello,
everybody.
Welcome. So before we get into the presentation of restoring facial balance and talking about dermal fillers, I thought I'm just gonna throw, as usually, a curveball out there. For looking at the internet and for some before and after, since we can show our patients, I thought that we were going to use celebrities. And so what I know from Mickey Rourke, obviously he is a famous actor. I mean, he was a professional boxer, so that might explain some of the way he looks on the right. But I think it also has to do with fillers. So can you explain to us what really is going on with his face as it is now?
Yeah, so first of all, that was an interesting result of the poll, where a good percentage was worried about looking unnatural. So this is probably not the best image to see after that poll, because that just reaffirms what people are worried about when doing fillers. As you say that he was a professional boxer, so that may explain some of the changes on his nose. It looks a little bit more rounded at the tip, for example, but some of that could also be contributed to by the aging process, as I'll show later. But a large part of what you're seeing here is going to be the attempt at restoration, so attempt at recreating back his original features. The main thing I'll point out is when I take a quick look, I would say that he appears more feminized. So he looks a bit more feminine on the picture on the right. The second thing I'll say is, to a certain extent, he looks a bit like lionized, looks a bit like a lion, I think is the term I would use. And if you break that down a little bit, I feel that the placement of fillers, for example, to replace back his cheekbones, was positioned a little bit too low and medial, so too much in the center. Whereas you can see on the image when he was younger, his cheekbones, where the light hits the cheek, was very strong and very high. So he probably could have benefited from a bit of filler there rather than in the center part of his face. The other big change is the arc of his jawline. You can see on the original image how sharp this was. His mandibular angle was very strong. That's exactly where the light was hitting it. Now you can see that this is not as strong and precise as before. Part of this is, of course, a weight change, but part of this also is because of bony change as we get older. And the third thing I notice is there's that fullness next to his mouth. So it looks like an abnormally full area. This is probably a combination of the jowl fat pad and probably to a certain extent an attempt at correcting what we call a marionette line, so the lines that go down here. The placement of the filler is probably to mask that line and as a result has created or increased the volume in that very area. I'll point out the lip, of course, your cursor was there and you can see that that is just not a natural looking lip for a man or for a woman, right? And so there's definitely some things that could have been improved in the way he was rejuvenated, I'll just say. Does that answer your question, Gunther?
Yes, yes. So that really sums it up very nicely. That millimeters make a difference, and I think that's really a core message here. That the filler placement and it is both art and science. It is not as straightforward as some people think it is.
That's right. That's exactly correct.
Okay, so I'm going to stop sharing now, and I'm going to now let you take over and run through with us your presentation on your view of dermal fillers.
I'll just turn on my pointer. And again, I echo Gunther in thanking everybody for joining us today. It's the first weekend where things are open in Singapore, and it is Father's Day weekend. So it's really a challenge of probably to stay indoors in Singapore. The only thing helping us is the bad weather outside. So I appreciate your attendance and joining us today. And please go ahead and ask us questions. If you look at my title, it is in fact about dermal fillers, but there are two key points I'd like to emphasize. The first is the term restoring facial balance. This is because, as I'll show you later, a large part of what happens as we get older is a differential volume loss on the fat and bony parts of our face. So some parts of our face lose fat, other parts of our face may actually gain fat with weight gain. And it is that differential balance that contributes largely to the classic appearance of an aging face, not to mention the skin and laxity and all of that, but the volume change and the volume redistribution, I call it, is contributing largely to the appearance of aging. The second important point here is what Gunther also alluded to, the term fine-tuning. The reason is, as he mentioned, 2 to 3 millimeters can make a big difference, a profound impact on the overall appearance of a person. On the other hand, if it's a 2 to 3 millimeters in the wrong direction, like what you saw with Mickey Rourke, it can actually make you look unnatural, just as like what many of you were worried about in the polls. And so it's very important to understand that this is the most technique-dependent procedure of all of non-invasive facial aesthetics. And a large part is understanding whose physician's philosophy you are most like with or that you most agree to, because there are many ways to do this. Now, as Gunther mentioned, we're a little bit handicapped with our ability to discuss dermal fillers. In Singapore, we are prohibited from showing before and after photographs, even if a patient consents. We're also, to a certain extent, prohibited from showing an actual procedure. But you'll see that even from publicly available material, there's a lot that we can learn and a lot that we can see. Our topic today, of course, is on volume replacement, but I always like to say that it is not just about doing fillers. You'll see later that aging affects a variety of different layers of the skin. And in fact, the appearance of aging is a dynamic interplay of changes in our soft tissues, that's the skin, the fat, the ligaments, the muscle, and the skeletal structure. And so we want to improve all of those aspects of aging, and no single treatment can correct that. And so what you see in this image, this is an interview done of me by Harper's Bazaar in Singapore, but you can see the machine known as Ultherapy here. Actually, if you look up close, you can image and see the depth of the target layer of the skin that you're treating. And so collagen building is always important. In this slide, I show you three beautiful young women of different race and ethnicities. This is not the goal, of course, of doing fillers. It's not to make a person look like one of these three, but it is to show that there are some general commonalities as to what makes these faces attractive, so regardless of race or ethnicity. So the key part that we look at when we look at the person first is what we call the central triangle. It is the triangle that is formed by the eye, the cheekbones, up to the lip. This typically, what I would say, is the first thing that you see when you see a person. And so to me, the goal of rejuvenation is not to change your central triangle, but it is to restore it and to remove distractions from your own central triangle. And so I'll explain later how exactly I look at that. Again, aging is multidimensional. We discussed skin quality, skin laxity in a couple of our presentations before. We need to address that, because if you're just addressing with fillers, pretty soon the texture or the consistency of the skin is not going to be able to support the fillers that we are implanting or placing in the tissues. There's a strong component of muscle movement, though this is the dynamic wrinkles. This is not the subject of our discussion today, but it's always important to look when watching a face. Are there negative vectors? Are there muscle movements that contribute to the aging process? What you can see most dramatically in this drawing here is the platysma. So this is a muscle that comes from the clavicle up to the lower face. The action of this muscle is to pull things down. We tend to activate it when we're exercising, sometimes when we're speaking or we're lifting weights. But over time, the repeated pulling of the fat pads on the face then blurs the jawline. So the muscle part can contribute to the jowl formation in the lower face. Today's topic is on facial volume, and I'm going to show you that there are two aspects to this. First, the fat changes, and second, the bony changes. You can already see here, by the way, that it is the outside of the face that tends to hollow, and of course the top part of the face where we lose volume. And so our general approach to rejuvenation involves looking at the various layers of the skin. Other fantastic doctors only do fillers and do a great job with it. But to me, I believe that you need to improve all of these layers in order to have the best and most natural looking outcome. We improve skin quality. We discussed that last time. Reducing the muscle component. This is, of course, with the treatment of botulinum toxin. The brand we use most in the clinic is Botox. There's replacement of collagen stores, not just in the layer of the skin, but also in the layer under the skin that holds the skin in place. And our focus for today will be replacing soft tissue volume loss, and to a certain extent, replacing some of the skeletal or bony changes that happens to our face. This is a slide I always borrow. I always use this when I'm speaking to a patient. The reason I love this slide, which is taken from an Ultera presentation, is because it frames the various treatments in context. It shows, for example, that the top of the skin, called epidermis, this is where we have pigmentation. As we get older, the skin turnover slows down. This is the layer where then our skin becomes dull. The first three treatments you see here target that layer. So chemical peels, the skin care that we discussed last week, IPL, for example, tends to target the epidermal layer. When we're thinking about texture, we need to go a little bit deeper. That's where lasers come in. That's also where microneedling comes in. And then for lifting, we need to go deeper. And that's, you can see here, various treatments that can build collagen, but the deepest of them all at the moment is Ultherapy, which goes up to the layer where a partial facelift is done, this mask layer. This muscle or this pink tissue here that is striated, this is the muscle. And so when we inject Botox, it is this layer that we're treating, because when you move a muscle, you're creasing everything above it. So you're creating a wrinkle all the way through up to the muscle layer. Where do we place filler? So you can see going back here. Neurotoxin is there, that's of course Botox, but really fillers to us are among the most versatile procedures. The reason is you can see that there are multiple layers at which we can apply a filler. If we place it in the dermis, we're targeting skin quality. So you can hydrate the skin, you can to a certain extent stimulate collagen building. Some fillers are better at that than others. I'll talk about that later. Then if you go a little bit deeper, you're now touching the subcutaneous fat pads. So when you replace fillers here, you're reforming contours of the face, such as the lower face, for example. And in fact, you can place fillers under the muscle, closer to the bone. This is when we're replacing things like the cheekbones or even the chin. And so because of that, fillers are really versatile. How you place it, how deep you place it, what you use, what filler you use, makes a big difference in the final outcome. Now I'm going to frame what happens to the face in terms of volume as we get older. We know this famous woman, and I'm going to peel off the top layer, so we're not going to focus on the fact that her skin is bright and luminous and clear, because we're going to focus on volume today. A youthful face has a balanced, even distribution of the fat pads and fat tissues on the face. You do not want to see edges or ledges. So it needs to be even and smooth. It doesn't need to be all full, but the contours need to be well blended. I also look at the central triangle, as I talked about. So the eye, the cheekbones, up to the lip. The reason to me this is the most important is because the most common complaint of patients that come to us actually is looking tired. And it is changes in the volume distribution in the central triangle that then distracts from our inherent or natural beauty. Because making us look tired is not a very good thing. Even if you've slept, a lot of people will say, hey, I look tired even if I've slept so long, even with this period of circuit breaker and I'm just staying at home. And that's because of the changes in the fat structure in the central triangle of our face. I also look from the front at the jawline. So you want this sharp and unbroken. And to a certain extent, I look at the temporal convexity. So you want a slight fullness there. It is not something I chase, however. I call that part a glamorizing part. To me, it's less of a foundation, unless a person has very, very hollow temples that can make them look skeletal almost and quite aged. From the profile, I look at 3 arcs or convexities. The most important to me is what's called the OG curve, OGEE. This is a smooth, unbroken curve that starts from the under eye area, arches out on the cheek, and ever so slightly tucks in under the cheek. So it's almost like a little indentation. You want this unbroken, and you'll see later that a lot of the aging changes you can see with this breaking of the OG curve. You can also see that a lot of the unnatural treatments with fillers is because of the incorrect correction of the OG curve. I'll show you some examples later. Now, the degree to which this bends in, what we call the submalar hollow, really depends on the face, depends on the preference of the person, depends on how they looked like when they were younger, which is why to me it's very important to ask for a photograph of a person when they were 5 years younger, because we want to bring you a little bit closer to that point and not change your appearance altogether. Just to point out there, generally speaking, Asians do not like such a sharp submalar hollow or the hollowing on the lower face. Caucasians tend to like this because it suits their overall facial structure better. The second most important arc to me is the arc of the jawline, which we want sharp and unbroken from the corner of the mandible up to the tip of the chin. And so this is very important to look at. It's a sign of laxity or sagging if we begin to lose that area. The third part is the convexity of the forehead. This to me, again, is less critical than the other areas. This is, though, very popular amongst Koreans who like a very bossed, shiny forehead. But to me, it is less important than the other two. Earlier, I talked about having a confluent, even distribution of fat pads on the face, but when you actually peel off the skin, the fat on the face is not confluent. They're discrete anatomic entities. And what does that mean? It means the fat pads have boundaries. And more importantly, when we get older, we don't lose the fat on the face evenly. We lose them in a very particular manner, as shown in anatomy studies. As it turns out, we lose volume first around the eye area. So it's both under eye and above the eye. And so if you have naturally deep set eyes, it will tend to appear deeper over time. The second part where we lose fat is the cheek, it's the front of the cheek. When you think of the cheek, it actually is made of several compartments. And so when we say, oh, her cheek is less full over time, it's not the entire cheek. It's typically the middle part of the cheek where we lose volume. The third part is the outside of the face. So again, the temporal hollow and the fat pad and supporting structure close to the ear, the periauricular fat pad. Later, you'll see there's also some bony changes. But when these things happen, when we lose volume in one part of the face, let's say the cheek, you will have less support for the fat that is left behind. That actually contributes to the formation of a nasolabial fold. So when the nasolabial fold then moves down, the treatment should not be to correct the fold here. It is to lift the fat pad back up by putting the volume change back up here. And that's a lot of the unnatural result of fillers, is because the placement sometimes is to correct a line or filling a line, when the idea should really be to replace back the lost volume to create a lift, or a liquid lift as we call it. Here just shows you the image, a diagram of the fat changes on the face in an uneven way. When we are young, we already begin to see separation of the fat pads. This is someone in their 30s. This aggravates in our 40s, and you can now see once you have fatty loss in the cheek, the under eye fat pad can actually stand out more, especially with poor skin quality. So it looks like an eye bag. So the appearance of an eye bag is partly the skin, partly subluxation of the natural fat pad, so it comes out. The third is the loss of the fat under the eye area that then creates an appearance of separation and the appearance of tiredness. You can see here past menopause, all those fat layers tend to get lost even further. But you can see in this image that the nasolabial fold, the jowl fat pad tend to stay. And in fact, if a person puts on weight, where we have the residual fat pad, it tends to relatively hypertrophy or grow even more. And what you see then is this cascade of events, as I'll show you here. The loss of volume in this under eye, the mid-cheek area, there's less support for the nasolabial fold, it moves downwards. The loss of volume on the outer side of the face, there's less support for the jowl fat pads, it moves downwards. There's also a collagen loss contribution here, and this is one of the reasons why it's very important to tighten the skin in this gentleman, not just put fillers. You see this line here, this is what we call a marionette line, like a puppet. It is formed and it is a very strong hard stop, I call, for this fat pad because there is a true ligament that blocks it from further moving down. Looking back then at what I pointed out in Kate Middleton's profile, if we look for his OG curve, you can see it's no longer this smooth curve going out and coming back in. Instead, you can see a hollowing under eye, the residual part of his cheek. There's a second depression and there's a second fullness here. So it looks more like a number 8. If you look at the arc of the jawline, it is broken. So you don't see the sharp edge of the jawline from the angle of the mandible going down to the chin. Part of that is also the bony changes on our tissues. So if we peel the fat pad layer, and then now we look at the bony changes. On the left is a young skull. On the right is an older skull. I'm going to go back to that. There are predictable changes to our bone, our facial skeleton, as we get older. You can see here that in general, the face shortens. If you go from the top, you can see that the orbit widens, so it becomes bigger. And that's part of why the eye appears more sunken. The cheekbone flattens, so it's not just the fat loss in front, but it's also the flattening of our malar cheekbone. And with that, there's less support for the nasolabial fold, and then it moves downwards. If you look at the lower face, you can see marked changes first in the jawline. We lose the angle of our mandible, so it's no longer this beautiful L-shaped sharp structure. It actually moves a little bit forward, the lower jaw or the mandible. You can also see that the bone structure of the maxilla, which is the upper jaw, and the mandible, the lower jaw, it thins, so that what we call the alveolar processes lose bone. And with that, there's less support then for our lip. The lip length goes longer, the lip goes inside, we have peri or oral lines. We also have a depression under the chin, and the chin tilts up, and our lip has less support. So these are all characteristic signs of the aging process. This is the view from the front. You can see the thinning of the jaw, the enlargement of the orbits, tilting downwards even, and the enlargement of the nasal area. And this is part of the reason that the nose sometimes tilts downwards as we get older. Now, the good news is we can correct some of the bony changes as well, especially the cheekbone, but also the nasal fossa, but also the jawline with the placement of fillers. This image puts it all together. So you can see the central triangle over time. There's less diffuse, confluent fat pads. You can actually see separation. You can see the nasolabial fold. Now, again, when you correct this nasolabial fold, we're not going to place a filler here, because what contributes to this is the movement downwards of this fat pad. And so if I'm going to put more volume here, I'm going to round the front of the face like so. So some people say, oh, I look like a bulldog the last time I did the filler there. That's because it's not necessarily the right place to start putting a filler to reduce that. If you look from the profile, you can see the OG curve gets broken over time. You can see that it's no longer as smooth as in this young person. And of course, the jawline with the loss of the sharpness. You can see here the contribution of the muscle very well. You can also see it here. So the repeated pulling of the platysmal bands contributes to jowl formation. So sometimes we treat this area in order to reduce that repeated pull to minimize the formation then of a double chin. I've shown this slide in the past, but I will show this again. And the reason is we place fillers differently. Depends on the person, but certainly depends on the base structure of the face. We know there are clear differences in Asians and Caucasians. In Asians, for example, the superficial parts of the face or the tissues, there tends to be more melasma formation. Our skin has more melanocytes. Our dermis tends to be thicker, and so we tend not to wrinkle as much as, for example, Caucasians, where the thinner dermis then folds. With repeated folding, you can create more creasing all around the face. With the fat and bone structure, there are clear differences. For example, for Asians, our cheekbones are broader, so there tends to be greater support out here, but we tend to be flatter in front. And as a result of that, it's much easier for our fat pads to move downwards to form the nasolabial fold and to give us the appearance of what we call the tear trough. With Caucasians, it's rhytids or wrinkles, it's movement, a lot of volume loss in various parts of the face. There's also loss of volume under the eye, but the correction is very different for Asians and Caucasians. And I'll show you that in this image. You can see the jowling is much more significant in Asians as a general observation. You can see for Caucasians, it's really more hollowing and volume loss and more wrinkle formation because of the movement. If you look at this in a cartoon version, you can then see the changes or differences between Caucasians and Asians. And again, as Gunther mentioned, to us, this is a very important aspect of our clinical care, because in general, we see a large percentage of both of these. And if I were to treat an Asian the same as I would treat someone with a different bone structure, it would not give an ideal or a natural result. From the top of the face, you can see the movement. So these are expression lines. You can see crow's feet, droopiness of the brow. You can also see what's different between these two images is the number of lines. As I mentioned, that's because the skin tends to be thicker in Asians, but also the general fullness. So the greater the extent of jowling for Asians because of the thicker fat pads, but also the formation of marionette lines in Asians, again, just because of the weight of the fat pad, it tends to move downwards. It's a little bit more challenging than to lift that back up. And that's why it's important to do combination treatments in Asians. And I'll show you later an example of someone where I would do a combination treatment. Caucasians have the same, but you can see a little bit more changes in hollowing of the lower face. This is what we call an accordion line. Like when you play the instrument, you're creasing the skin. And so we often will put a tiny light diffuse filler here to create a lift and soften the accordion line formation. And these are actual people now. This is taken from a publication by Vashi. You can see the change on the left versus on the right. You can see more hollowing on a Caucasian face, little bit more wrinkle formation, more lengthening of the upper lip because the lips are thinner to begin with as compared to the lady on the right. You can see a lot more perioral lines all around here. And whereas for this Asian lady that they have in their publication, melasma is very prominent. There's an appearance of greater heaviness of the nasolabial fold, the marionette line, and even the submental fold area or the fullness. But the good thing is the lips are well preserved, as you can see here. I'm just going to say that there are some fantastic physicians out there that use the golden ratio as a way to treat or to guide them in placing fillers. The golden ratio is derived from the Da Vinci Man, and the idea here is you can follow these ratios. So for example, the nose, if you use the base of the nose as a 1, you want the lip to be 1.6 or 60% wider than the width of the nose. The intercanthal distance should also be 1.6 and so forth. And so there are some rules that a lot of those who follow the golden ratio will use. The reason I don't use the golden ratio is, to us, every person has an inherent beauty, and it is not about changing their face to look like someone else. It is to rebalance and restore them back to the more youthful and better version of themselves. An extension of the golden ratio was created by a particular doctor years ago, and he created what's called a beauty mask. The beauty mask still follows the golden ratio, but combines it in different aspects on the face. And his thinking is that every single beautiful person can fit into this mask, regardless of race or ethnicity. And so a lot of the information, they will try to fit a mask on a person. So for example, an example that I found online was this Asian woman. She fits nicely in this mask. But to me, she's not a typical Asian woman. She's not necessarily the most beautiful and the only beautiful Asian woman I've seen. And most, like the lady I showed you when I showed Scarlett Johansson, the third lady, she's Filipino-American. Her nose is broader than the other two ladies in that image, and yet she was strikingly beautiful as well. So that's the reason why I tend not to follow ratios or superimposition of the beauty mask, but I thought it was good for you to know that this exists. What is our approach to replacing volume changes then? We really believe the statement of Eleanor Roosevelt's that beautiful young people are accidents, they're lucky. But beautiful old people, really, it's a combination of character, charisma, an X factor, your life. And so we don't want to make you into a beautiful young person. We want to make you into the best version of yourself. We use this image because this is one of my favorite books. It's The Lady in Gold. This is, of course, Adele Bloch-Bauer, the muse of Gustav Klimt. And you can see she is not a traditional beauty by any means, but is beautiful and memorable nonetheless. So my general approach to placing fillers is to restoring facial balance. We want to rebuild back the arcs and convexities of youth. We can actually change it, tweak it a little bit, raise it up by 1 millimeter or so. Paying attention to the central triangle and the arc of the jawline. We want to reduce the appearance of separation of fat pads because that's really distracting. So we don't want to see the edge of the fat here or the edge of the nasolabial fold. We want to help blend this. Our goal is to bring you closer to a more youthful version of yourself without anyone knowing that you've done anything. And this is really, really possible. Our focus is on the foundation, and to me, that is the central triangle. This is a hello from Singapore. Marina Bay Sands, of course, is one of the most striking images of Singapore. This has been closed for the past 2 months and is only beginning to open. But in order to build a beautiful structure, you need to have an intensely strong foundation at the base of this building. And that's how I believe the filler should be. You want to focus on the foundation and not work on the embellishments, because otherwise it's not going to be as natural or as well supported. I talked about pulling online for before and after photos, and this is one of them. This, I do not have her name, but I always thought this lady is one of the most beautiful women in Hollywood. Her central triangle when she was youthful was very striking. You can see the OG curve, you can see the jawline. And this is really very similar to the Mickey Rourke look, right? You can see that the middle of the face has become excessively filled, and the highest point of her cheek, I believe, is too low for her face. It makes her look a little bit like a lion, as I said earlier. Obviously, her lips are very unnatural. If you look from the side, you can almost imagine that her OG curve is broken and flattened. Her jawline has not been corrected. And so again, such a pity, but there's a possibility to improve her though with the proper correction. This lady is very famous for aging very well. And you can see, first of all, her physician used to be a very famous doctor known as the Baron of Botox in the United States. He has since passed away. But you can see her original face is nothing like when she was at what I consider the peak of her physical beauty on the face. You can see her cheekbones have strengthened. She always has had great cheekbones, but this is now stronger. If you look down at her jawline, she had a very full angle here. This is a masseter muscle that overlays the mandible. You can see that that's been treated. So this is treated with botulinum toxin to hollow her lower face. Although her jawline was always very strong, there's a little bit more enhancement here to lengthen the face. So the net effect of this is to lengthen the face, to make it more balanced. And what has happened here more recently is the face, as I said, has shortened. It appears that the chin has not been corrected, so it looks more square. Obviously, there's a little bit of overfilling down here, as you can appreciate. And to me, this usually suggests that the marionette line, in an attempt to correct it, fillers may have been placed here, and it made it look too full, right? So the idea being, do not put fillers where the line is, you put it where volume has been lost. So that's the whole overriding principle. This lady, I think, has had a great outcome. Again, I apologize, I don't remember their names, but you can see that the hollowing of her upper eyelid has enhanced her beauty and has made her even more attractive. It is possible that she's had lifting here, and that could be done with something like Botox. You can lift the brow, filler placement in the temple, or even ultherapy can do lifting, brow lifting. Depends on the contribution of which of those three aspects has pulled the brow down. She's always had great cheekbones, and you can see this for sure has been enhanced because this looks almost the same as when she was very young. And you can see also that she's keeping lines, so she's allowing some of the lines to stay, therefore resulting in a more natural appearance. She's also had work on her lips in a nice way. You can see that here when she was younger, the white lip was a bit longer, and you can see that the upper lip is a little bit thinner. So this has now been corrected. You can see the philtral column, so the two columns that go down here, but also the lining of the lip has been treated and a little bit of volume. A few slides then on technicalities of a filler. It is typically a soft tissue gel. Sometimes it is a liquid, as I'll explain later. You can use it to fill lines, correct depressions, reshape the face, improve fat and bony changes, and enhance certain facial structures. The great thing about fillers is they improve the quality of the skin as long as they are the high quality fillers. So it's been shown that fillers improve hydrobalance and have, to a certain extent, collagen building properties. Some of them have more collagen building than others, as I'll explain later. And of course, fillers are not the same as Botox. A lot of patients who come and have not had an introduction to procedures before typically get these two confused. As I talked about earlier, you can place the filler shallow. This is within the dermis, in the subcutaneous fat, but actually even under this area, under the muscle layer to correct bone. Collagen fillers have largely been replaced by these two fillers, hyaluronic acid fillers. Hyaluronic acid, as I'll show you shortly, is a natural substance in our skin. Calcium hydroxyapatite filler, the brand is called Radiesse. Polylactic acid, the brand is called Sculptra. It was originally approved for the facial fat wasting for patients with AIDS or cancer, but now it's used for general rejuvenation. Let's start first with hyaluronic acid fillers. This is a sugar. We make it in our skin. It's our skin's hydration molecule. Large amounts of it are in our skin. As we get older, we make less of it. That's one of the reasons why our skin becomes thinner and drier. It is biodegradable. So it's like an apple that you plump up. What makes the filler different is they are cross-linked. The cross-linking process or the modification process can change the characteristic of hyaluronic acid. There are various great brands. The one we use is Juvederm. The reason we use Juvederm is there are 7 forms of Juvederm, which allows us to be very versatile in what we're trying to do. We can change the cheek in a sharp way or in a soft way, depending on the appearance of the person, depending on their natural beauty. Juvederm, you can use a great skin booster, so that hydrates the skin. We can use a very soft one under the eye, the lip, and now there's a Juvederm filler that is really good for sharpening the jawline that can last up to 2 years. But I will tell you right now that fillers, what differentiates it is technique in 80% to 90%, and maybe the remaining 10 to 20% would be the product, as long as you stick to the high quality fillers. Now, hyaluronic acid has a low risk of allergy because it's something that we have in our tissues. There's a lifting capacity. That is how we describe hyaluronic acid fillers and other types of fillers. Its ability to lift and recreate. Typically, it means fillers with a higher lifting capacity are stickier, are firmer, more cohesive, so they're stuck together more and last a little bit longer. As I said earlier, they can restore hydration of the skin, improve elasticity, and even firmness. A lot of people who start fillers with us, we would start them with hyaluronic acid because they are reassured by the fact that you can immediately reverse a hyaluronic acid filler. So they don't have to, they're not going to walk around looking like Mickey Rourke, but at least they're reassured by the fact that there's a reversibility to hyaluronic acid fillers. The other filler we use in the clinic is Radiesse. This is a calcium filler, which is another natural substance in the body. In clinical studies, it's been shown that calcium filler, particularly Radiesse, has a bit more neocollagenesis. So it is called actually a biostimulator. So not only does it correct the aesthetics and the volume change, but it has the ability to stimulate collagen building. Radiesse, though, you can't use in certain parts of the face, such as the lips or the eye. It is much too firm for it. But we can modify the way we dilute or mix Radiesse so we could use it in very fine areas. And in fact, we're doing a study right now where we're combining Radiesse and Ultherapy to tighten the underarm skin to reduce the batwing appearance. So this just shows you how they look in a microscope. These are different Juvederm fillers. This is a thicker one and one that's called Ultra Plus. These are finer ones. So this is Volift and Volbella. You can see they're nice and even. When you look at radius, you can see more spheres. Spheres are of the shape of 25 to 45 micrometers. Those calcium spheres dissolve over the course of 4 months, but while they are there, they're stimulating collagen building. I just also want to point out, what is the filler volume? So it is very rare that I would recommend 1 syringe of filler, not anymore. And the reason is, if you look at this, this is a teaspoon. 1 syringe of a filler is really a few drops of that. And so if someone who's in their 50s comes to me and wants a lifting, a rejuvenation, 1 syringe is going to make hardly any difference. And so it's important to frame this in the context of a particular person. Now, we use them to correct eye bags or tear troughs, reduce lines around the mouth, reshape the nose, chin, and cheek, increase the fullness of the lips, make the face fuller in someone who's lost a lot of weight. We have a lot of marathon runners that we see also, and weightlifters, we see them in our clinic. And sometimes it's too hollow because they've lost a lot of fat in order to lean up for a competition. And sometimes you want to just soften some of the edges, make them fresher. We also use fillers to improve skin quality. A lot of times we use the term liquid facelift because when we place on the cheek, for example, you're able to correct a few things. You're able to improve the under eye area in many people, soften the nasolabial fold, and lift the fat pads on the lower face. We can even use it to correct the hollowing of the back of the hands. These are just the same thing, but in an image form. Now I'm going to show you the most common complaint, which is I look tired, and this is taken from a publication, as you see here. The tiredness look is because of a combination of volume loss on the cheek, as I mentioned earlier, typically the front of the cheek, as you can see here. There's volume loss in the under eye, and because of that, the fat pad that is close to the under eye, the palpebral fat pad, looks separate and can look baggy if the skin is not able to support the fat pad. And so looking tired is a combination of skin, of those fat separation, and the bony changes. And so it's this complex dynamic interplay of these factors that we need to address, not just one of them, but all of those changes that happen. I borrowed this from a publication. This is the only before and after I will show. So this is the tear trough area in this person. You can see several things happening. There's a volume change here. She has naturally deep set eyes. She has an extra line up here, and this is formed because of the muscle that's close to her under eye area. You can see a very slight hint of hollowing of the front of her cheek starting already, and it makes this line look strong. And of course, there's a component of pigmentation, which is one of the hardest to improve because this is what's called hemosiderin staining. It is leakage of hemosiderin or iron into our tissues. Very, very difficult to correct. So how would we address this? It's cheek filler first to lift, and then a soft filler here, and a little bit here. So this is what is after. This is a classic appearance of a well-done filler. She is, of course, young, so the skin is firm. It gets more challenging when the skin quality is also inferior, and we need to improve the quality of the skin as well. So again, unable to show before and after. So I'm just going to share with you that we treat young and older individuals. Young individuals could be recreating a balance, a little bit of the chin area, or sometimes a common concern is the lip, especially for Caucasians. When someone, not necessarily older, when someone is beyond 35 or 40, it's about rejuvenation and looking fresher and looking like themselves, but still fresher. We use the term tweaking a lot. It's a millennial term. They want 1 or 2 millimeters here and there. This includes fillers. This includes Botox. For example, the diagram that you see here is where I would put the filler in this person. So I would put the filler to heighten the nose, the dorsum of the nose, to make it look a tiny bit sharper, not to look artificial, not to look like somebody else, but to catch the light a little bit more, and maybe potentially a little bit on the lips. So I'm going to run through these because these are just theoretical, as we can't show you some actual after. One of the most common concerns for Asians is Actually, just a couple of days ago, someone came to me and her concern was she had a double chin. She was young. And when you look at the double chin, it could for sure be fat under here. It could also be skin, although that's unlikely in a young person. But often in an Asian face, it's actually because there is retrusion of the mandible. So the chin area is not as well developed. You can define that by looking at this line. So this is just one of the guides we use. This is called the Steinert line. When you draw a line from the tip of the nose that should touch the lip, the tip of the lip, the chin is meant to touch that. So in this young man, you can see there's this much gap. And correcting this will lengthen his face, will give support to this fat pad here that can make him sometimes look angry and can give support to the chin area, the double chin area. So this is one of the most, I would say, one of the easiest, one of the most profound improvements when you can create a balance, especially on the chin. It is also one of the safest areas to place fillers. This is just to show you a before picture. So this is placing and correcting where there is flattening and hollowing because we want to blend this area. And again, in this young woman, she would benefit from chin. You can tell that because typically you want the lower part here, the chin area, to be a bit longer than this white lip in order to create a balance to the face. A very common concern is looking tired, and it's classically putting a bit on the cheek and the tear trough area. This is just to show that you can use what we call skin boosters. So these are super light fillers that you place within the dermis to hydrate the skin, stimulate collagen building, correct acne scars, for example. Again, you can see I'm running through these because I'm not going to be able to show after picture anyway, but it's really about correcting where there's the depression. The tear trough, by the way, is one of the most challenging areas to treat. If it is not done properly, if the right material is not used, you can have what's called the Tyndall effect, where it looks bluish if it's placed too shallow. So in certain lights, it looks blue. You can also, because the tissue there is very soft, so you can also create an unnatural bulge. If you correct the tear trough too close to the eyelid, it can compress the eye and make the eye look smaller and unnatural, right? So it's very important. Again, here's a tear trough, typically a little bit on the cheek first. Regardless of ethnicity, often we lose volume there. The actual placement is different, the actual volume is different. Often we also put on the cheekbone area, especially in Caucasians. When someone is in our 30s, late 30s to 40s, we begin to then address certain negative emotions, like, again, as I said, looking less tired. Sometimes it's looking less sad. And so this is one of my favorite women in the world. She, to me, looks sad when she's not smiling. And so Gunther was asking me, she is, of course, Angela Merkel. He was asking me, well, you know, she's got these really strong marionette lines, and how would you begin to improve that? So that's very challenging. So one way is to put a filler there, but would that be the right way? Probably not, because you can see she is already full here. So we would bloat her up and make her look, a patient asked me the other day, why did this person look like a bulldog? So that's what I would do if I put filler here. I would end up making her look unnatural. So that is not the right solution. The better way is to see and assess her face. Again, let's look at the central triangle. You can now see droopiness and hooding of the eye, so we can improve that with toxins, Botox, or therapy, and potentially she would benefit from a filler up here. If you look at the mid face, we would need to improve the quality of her skin, so it looks a little bit inelastic. And you can bet when you touch her skin, it's not going to be resilient. It's not going to bounce back. You can also see the loss of volume. Look at her OG curve. It's not smooth. So she could benefit from cheek and tear trough filler, both inside and outside of the infraorbital area. We need to restore back the arc of her jawline and put the fillers back here before we touch this and see how that changes. I would for sure look and evaluate if she is a candidate for a treatment that freezes the volume under the chin. We have several machines for this. One example is Cool Sculpting, and the other one we use is Z-Lipo. So we use both depending on the shape or volume. So I need to shrink it and tighten it. The order I would do it is here. I would tighten the skin, improve the skin. I would improve with ultherapy and laser resurfacing, cool sculpting for down here, and then I would do fillers. Could I do fillers first? Depends on the quality of her skin. Maybe some parts I can already begin to lift and improve the face so she can see an instant improvement. The last section, I'm just going to give you some pointers. Not all fillers are equal. Some stimulate more collagen than others. And I mentioned that even among hyaluronic acid fillers, they differ in stiffness, the ability to lift, longevity, and the concentration. Different fillers do different things. As I said, you're not going to want to put a cheek filler in the tear trough in the lip. Those need different types of fillers. Otherwise, it's going to look unnatural and not well blended. Treatment with fillers is 80 to 90% technique dependent. I mentioned this earlier. And so you want to stick with top tier US FDA approved fillers. You want to be treated in a center that does a lot of fillers, that does this day in and day out. Pick a painter, as Gunther said, not the paint. Because the same great filler, even if it's Juvederm, if it's placed in the wrong way, it's going to be unnatural and may even be harmful. So it matters who does your filler. It is an art in addition to the science. The same fillers may not give the same result in another person. So just because your friend did Voluma doesn't mean you are suitable for Juvederm Voluma. It depends on your own inherent skin type, beauty, facial structure. And so you want to bring a picture of yourself from a few years before if you're going to start with a new clinic and the doctor does not know your face very well. You can see this girl has had a lot of work, but what you can see most strikingly here is the jawline. The jawline, the arc of her jawline has significantly changed and has given her much more balance, not to mention the nose. So you can see the shape of the nose. There's a little bit of filler there. The shape has changed. We all know about her lip, but to me, it is the jawline that is the most striking here. Her angle has strengthened at the back. It's covered a bit by her earrings, but most importantly, it is the chin. You can see it's given her submental area more support, so it looks more taut. Just because you've seen a bad result of a filler in your friend or in a star, this does not mean your filler will be unnatural. And so great point that 55% of you worried about looking unnatural, but just because you've seen it unnatural in someone does not mean you will have problems when you do a filler. The best filler is invisible. No one should know. And as I was saying to Gunther, you can actually tell if a person has had filler, not because of how they look today, but how they look before in relation to today. And so you need a before and after picture, just like what we're doing with some of the stars. We know about this lady. She's a naturally beautiful woman, but what you can see here is, again, she's been lionized. So the placement of the cheek filler is too low, too full. She does not have the upper part of her cheekbone, as you can see here. She's also had too much Botox here. So you can see Botox is a very delicate art, actually, because how you do it, we do what's called baby Botox or differential Botox. Some parts of the face I want to correct well when I want to lift. Other parts of the face, especially crow's feet area, if you block it, you're going to impair the ability of the cheek to lift up when you smile. And that's what you're seeing here, the separation of the fat pad here. Obviously, the too full lip, you can see. So she's improved over time. You can see in some of her more recent appearances, she looks better. So that's been changed. And so that's the benefit of a hyaluronic acid filler or even Radiesse. They go off over time. This lady has been enhanced, right? So in a very subtle way, and you can clearly see where she's been enhanced. Largely, it's the jawline. So her jawline has been strengthened. So that is characteristic of her look. It is now squarer. The chin has been lengthened. She used to have a natural cleft, right? So also you can see where the light is hitting her here. Although this is a young, very young image of her, she's had a little bit of filler on the cheek as well. So treatment with fillers, and so one of the last few points, they do not add fullness or volume to the face. So you can have fillers and it actually looks sharper if placed in the right way. Look at this lady. She, of course, is extremely attractive. You can see the key things. If we start from the OG curve, so we're lucky we have the same angle, you can see where her cheek was fullest was low. Now it is higher. Like Madonna, when she was in the middle picture I showed, the cheekbone has moved up. She has that nice submalar hollowing, so that's been kept well. Her chin and jawline have been sharpened, right? So this is, and obviously potentially a little bit on the tear trough. So you can see putting fillers does not make you full. It can actually make you look sharp, like this lady. Lady Gaga popularized jawline fillers. That is the single biggest change in her. Yes, she's had a little bit on the lip. Yes, she's lost weight. Yes, there's a bit on the cheek, but it is the chin that has really changed in her and has given her a dramatic profile. Even this beautiful woman with great cheeks, you can see her original cheek. There's a gap here. She has a tear trough. So naturally she has this break here. Now the cheekbone is one unified line, that single unbroken curve that we're looking for. Even the jawline is sharper. So slight tweaks that enhance your appearance, 1 to 2 millimeter changes, but still follow your inherent beauty. Now, again, I mentioned that fillers is not about filling a line. The last point that you see on this slide is that often we place fillers in multiple areas. When you start, you want to go slow, especially if you've never done this before. Go step by step, because you can see an improvement right away. You want to go back if you want more. Try not to do all of it in one go, because there will be some swelling and potential for bruising and all of that. What we know also, as I mentioned earlier, fillers are not just to correct the aesthetics and facial balance, but they also improve skin quality. And by the way, there's a dramatic increase in minimally invasive procedures. The number one is still Botox, and dermal fillers are way up there in terms of popularity, even in patients under 30. Here, what you can see is what's Jennifer Lopez predicted to look like with a natural aging process. You can see the lines and the wrinkles, the skin quality, but with fillers and with the improvement in treatments that she's done over the years, she's only looked better. So you can improve the quality of the skin, overall facial balance, and the same with this Elizabeth Hurley. This is her natural face. You can see that would have been a natural aging process, still beautiful and very attractive. This is now slightly enhanced and looks a little bit different. You can see that where the cheek filler was placed is here, so it's quite different than her original cheek. The last thing, bad fillers can happen, but it doesn't have to stay that way. As I mentioned earlier, especially with hyaluronic acid fillers, they are reversible and you can dissolve it. Dermal fillers have been clinically studied for many years, a lot, hundreds of articles showing effectiveness and safety, but you want to stick to US FDA approved fillers. You want a track record of safety and effectiveness. Typically, most people will not have side effects. Today we had a patient, she's going out tonight, going out actually because it's Father's Day weekend, and she walks out looking fresh, does not look like anything happened, just looking a little bit, tiny bit better than her baseline. There's temporary redness for about 10 to 20 minutes. Potential for bruising is always a possibility. So you want to be able to cover that with makeup, but that's temporary. It is important to know you are walking through lion territory. Our face has a lot of blood vessels. That's why it heals very well when we have a cut. And so you want to go to a person who does fillers a lot and knows anatomy very well and does fillers all the time. And that, Gunther, is my presentation. I know it's a little bit long and a lot of topics covered there, but I hope I didn't drag it out so long and people stayed through.
That was great. That was fantastic. Now, before we're going to answer the questions, I have a question to you. you described the approach of how you look at beauty for a woman. Is that the same for a man, or are there any grave differences on how you would evaluate a man for fillers versus a woman?
That's an excellent question. Going back to Mickey Rourke. So in all cases, those four components, skin quality, the muscle, skin laxity, volume change, those are important. So I would look at that in a man, just like I would do in a woman. I would ask them to bring an older photograph. For men, the placement of the peak of the cheek is a little bit different than women. Because if you follow a woman's cheekbone, so you want a strong cheekbone that lifts up, you're going to feminize that man. The filler on the lip, you know, we've attempted it on you, Gunther, but you jumped off the chair before we could even start. Obviously, the shape of the lip, it's typically just hydration. You want to show just a little bit of pink. A very thin lip in a man can make them look stern, can make them look more fierce than they actually are. So tiny pink is good. Men, we also correct the tear trough area because they hate looking tired. But the jawline is one of the most important for men. So a masculine square jawline is what most men are looking for. Now, we don't want to create that if a man's natural jawline is sharper, more like a young boy. But you can enhance it ever so slightly with just a little bit more filler at the back, the angle of the mandible. Apparently, Brad Pitt has had radius to sharpen his jawline. So just some interesting Hollywood filler gossip there.
Right. Yeah. That's. I remember the lip filler is where I drew the line because I thought that's a bit much. But yeah, maybe at some point I'll take to that. So let me just have a look if there are any questions from our audience here. Let's see what we have. Otherwise, if there are no questions, I would like to thank all our listeners for spending the Saturday afternoon with us. I wish you all the best for the phase 2 and phase 3 of post-circuit breaker here in Singapore. And I hope to see you again soon. Thank you very much also, Dr. Sylvia.
Thank you very much. Thank you, everybody. And look forward to seeing you in the next few weeks.